Hello, everybody, and welcome to the Tiny Lungs Big Cough podcast. I'm Ibrahim, and today we're looking back at the terrifying cast of Whooping Cough, not just through the eyes of the parents, but through the eyes of the survivor himself. 17 years later, let's meet our incredible team.
Hi, I'm Leonardo, Camilo's parent.
Hi, I'm Brenda and I'm the microbiologist in this case.
Hi, I'm Andrea, QFB and clinical lab personnel.
Hello, I'm Camilo.
Camilo, let's start with your story through your parent eyes. Leonardo Camilo was 4 years old, highly susceptible because he wasn't fully vaccinated yet. Tell us about the moment you knew this was more than a flu.
It was gradual. It started with a runny nose, a mild cough. We think that it was just a cold, but after a week, the coughs become brutal. We thought he will be fine in a couple days, but day by day, he didn't get better. Were breathing holding attacks where Camilo would turn purple. He would cough and cough and cough, and then he make a sound that I will never forget. Was a forced gasp. That was made us to run to the hospital, and in there he was revised by erythromycin.
Erythromycin, that sounds like antibiotic, right?
Yeah, it's one of the usual choices for whooping cough. It helps stop the bacteria from spreading and shortens the period someone can infect others. In fact, studies show that early treatment with macrolides can prevent serious complications, especially in young children who haven't completed their vaccination.
Oh, so it doesn't just make the cough better?
Right, it actually fights the bacteria itself. For the telepertussis, the bacteria that causes whooping cough spreads through droplets. Then it sticks to the lining of the respiratory tract and multiplies really fast.
Wait, it just sticks there? How does it do that?
Well, it targets tiny cilia in our airways, the little hairs that move mucus, and it uses two main tools, like pertussin toxin and filamentous hemagglutinin. They were like tiny breakers that let the bacteria hold on and start causing the trouble.
Oh, so that's why the cough is so severe and hard to control?
Exactly, those cilia help clear mucus, but when they get damaged, the body struggles to get rid of it. That's what causes the violent coughing fits.
So giving antibiotics early is very important, not just for the symptoms, but to stop the bacteria from doing more damage.
Yeah, you got that right. We usually go for macrolide antibiotics, just like erythromycin, azithromycin, or clarithromycin. But the key is early administration, especially in young children, to prevent severe complications like pneumonia or even hospitalization.
Now I would like to turn Camilo. Camilo, can you tell us what it was like going through that situation?
The whole time was terrible. I was admitted to the hospital and spent 5 long days, and where the only thing I could do was cough a lot, and I was completely incapacitated, and my entire focus was just struggling to get a breath. And since that day, I get terrified when I catch just a simple cough.
That sounds terrifying, Leonardo. I can't even imagine how difficult that must have been for you as parent during that time.
It was so stressful. Watching him to struggle to breathe and seeing that constant coughing fits was heartbreaking. Some nights were especially difficult. Every cough made us worry that he would get no hair.
Camilo, can you share any particular moment that stuck with you from when you were little?
I don't remember all details, but I do remember lying in the hospital bed feeling so tired. I remember the doctor checking on me and seeing my parents looking so worried. Even though I couldn't remember everything at the time, but I remember very well feeling scared.
Like Brenda, can you explain why these symptoms happen from a scientific perspective?
Sure, as we were just discussing, the bacteria attach to cilia and release toxins that damage them. Normally, cilia move mucus out of the lungs, but when they damage, mucus accumulates, causing a violent cough. This is why children, especially those unvaccinated, can become so ill. And Mexico still experiences outbreaks, and young children are the most affected. And this is why I want to highlight the importance of vaccination, early diagnosis, and the correct treatment.
Andrea, tell us how do doctors confirm that it's really Bordetella pertussis causing these symptoms?
The first thing was confirming the name, PCR positive for Bordetella pertussis. The second, the big indicator, absolute lymphocytosis in blood. We saw the white blood cells and they were totally spiked.
Ah, that's where the villain comes in. Brenda, what does the Persona toxin do to make the cough so violent, even after the bacteria is identified? What's the cruelest virulence factor?
Well, the bacteria is a weak genius. Its main virulence factor is that toxin, which is basically a chemical potion. It latches onto lung cells and paralyzes them, causing anatomical damage. The lung cannot clear itself, so the cough is the body desperately trying to do the job of the paralyzed cilia, which is why it's so savage. And the toxin also messes with the immune system, which is why we see that lymphocytosis.
I can see that careful observation, early treatment, and lab confirmation are team effort, all working together for the best outcome.
Absolutely, knowing the lab confirmed the infection gave us some relief. It meant the doctors had a clear plan to help Camilo recover, and we will follow their instruction confidently.
We decided to move past antibiotics. We proposed synthetic human defense peptide therapy. This is an innovative therapy. This peptide act as immune system, just like peacemakers, and at the same time neutralize the toxins that were causing inflammation. It was a dual action therapy aimed right at the root of the problem.
That's wild, and it worked?
Yes, within days the toxin neutralization was evident. The inflammation subsided, and Camilo was able to start breathing on his own. And I could say that it was the factor that bought him time to recover.
Camilo, what is your life like today? Are there any long-term effects? What is your quality of life?
I'm a healthy, good guy. Fortunately, I suffer no permanent neurological or pulmonary sequel. My quality of life is good, is excellent. And my story is a reminder that we must use science for prevention, get vaccinated, and for innovation.
What a relief! Thanks to Leonardo for the courage to share this personal story and our experts for breaking down the science and the solution. We hope this episode helped you understand that pertussis is serious, but science is advancing. See you on the next episode of Bacteriology Podcast.